Before we get started, I think it would be worthwhile for us to look at what's happening in the healthcare industry at large and why are the changes that are happening now going to be different than what the industry has been focusing on for the last decade or so. To answer this question, I had a sit down with Anish Chopra recently, and here is what he had to say about the three big forces that are changing healthcare today that are different than anything before.
The healthcare system is undergoing a tremendous amount of change. Some would argue, I would argue, this is the most entrepreneurial period in the healthcare industry, at least in my lifetime and perhaps many generations earlier. And it's because of three trends that are occurring at this moment in time. The most important of which is we're fundamentally changing the way we are paying for healthcare in America. This shift in payment is changing what it is that doctors and hospitals are looking for on their tech-enabled solutions. It used to be, I want to submit a bill, get paid for the care that I had been documenting laboriously into my records so that I could earn my payment. Today, we're shifting from just documenting and billing to thinking about the population at large. Who are the patients that are not coming into my clinic that I should be thinking about, because if I could reach out to them, perhaps we could avoid an unnecessary trip to the hospital. The first step, rewarding those providers who move to that type of thinking. Second, in order to help them figure out which patients they should be focused on, government has opened up unprecedented amounts of health information, macro data, as well as patient individual data for health systems that are working with the Medicare program. This is opening up another feed of information that needs to be managed and used so that they can care for patients in a different way. And then last but certainly not least, the desire to make sure that as we've digitized what was previously in the manila folders, that we can actually exchange that information and coordinate care better so that whether or not that patient is being seen by me or a fellow doctor or a nurse practitioner, that we're on the same page. We're reminding that patient to take their medications, to take their preventive services, and so forth. These three trends, the opening up of data, the changing of payment, as well as the interoperability of records, are what make this the most entrepreneurial period.
Welcome everyone to Apigee's Jumpstart Health Data Interoperability webcast. We'll be talking today about many exciting things that are happening in the world of healthcare digital transformation, and specifically introducing the Apigee Health APIx solution. To discuss all this, here with me is Aashima Gupta. Aashima Gupta runs our digital transformation practice for healthcare. Welcome, Aashima. How are you doing today?
Very good. Thank you, Anurag. Excited to be part of the webcast today.
Can you share a little bit about your background and what brings you to this solution?
Absolutely. I look in my current role, I look into the transformative opportunities with payers, providers, pharma companies. Prior to coming at Apigee, I was the exec director for digital health incubation at Kaiser Permanente, where I launched several of these frame-shifting opportunities. And now we're excited to share our new solution, Health APIx.
Fantastic. Now, we are all about APIs, and we have been recently tracking and collaborating on these FHIR APIs in the industry that everybody's talking about. Clearly, FHIR is a very hot topic, and we think very highly that it will change the healthcare industry. But before we get into the nitty-gritty of FHIR APIs and why those are so critical to the transformation, perhaps you can start by sharing with us, Aashima, what is going on in healthcare? What is the vision for which we require data interoperability and FHIR APIs? Perhaps start by sharing from consumers' perspective.
A great question, Anurag. There's a lot of talk in the industry about patient centricity, about consumer-driven health, and creating the experiences which are personalized. And so now let's make it real. I'll take you through a journey in next 5 or so slides from the shoes, walking the experience from the experience of a consumer. So with that, let me dive right in. Let's meet Samantha. Samantha is an average healthcare consumer. She is 47 years old, she is married, she has a health insurance from her employer. Unfortunately, she has high blood pressure and has been diagnosed with diabetes. Now, just like Samantha, there are over 30 million Americans who suffer from diabetes. And for these folks who have a chronic condition to manage, it's a lifelong collaboration to help them manage their condition. And our spend in diabetes alone is $250 billion a year. But it's not just about cost. It's also about having a human angle, having an empathy, and helping these consumers to better manage their own health. So let's see what I mean by that. For Samantha, what is the current experience? Samantha, being high risk, has been assigned a case manager. The case manager calls her every 2 weeks, shares information over the phone. She calls, okay, just checking on you. What are your readings? What is your medication you're doing? And then they prescribe, if things are not working, they change the dosage and with the care protocol. Now, this may look like an okay interaction, but here's the challenge. Samantha, as a patient, may or may not be available when the phone call happens. She may not feel comfortable giving that personal health information over the phone. But more importantly, who remembers your medication, your dosage? And typically there are 8 to 10 medications she's taking. And to remember that, what medication, what is the dose, is it generic, is it brand? And is it covered by my insurance? What is my deductible? She needs all that information every time the phone call comes, and that's the frustrating part. That's what she doesn't remember. So now, what is the new 21st century experience? When we talk about connected digital experience, what if we created a connected digital experience for Samantha, which looks like this, where she's able to pull her medication from a pharmacy. It's right at her fingertip through a mobile app. This is her connected digital experience. She's able to get her care plan from her EMR. She's able to get her health plan information for her insurance company. And then now, this is the big pivot, Anurag, where she's shifting from a passive recipient of care to an active participant in her own health. That's what the digital health transformation is about, empowering the consumer.
Very, very exciting. I mean, I can already see parallels from other industries which have obviously taken this leap and started bringing together customer-centric information and putting the customer in the center. So what have APIs and particularly FHIR got to do with this? And what's the barrier to achieving this vision today?
Another great question, Anurag. When we look into healthcare, the data that we talked about, the medication, the care plan, the EMR data, that's all locked up in silos. So your provider system or your hospital have your EMR data, your insurance company have your membership or the plan information, your medication information is with your pharmacy. Now all that data is locked up, and what FHIR has done is an amazing job in making these data elements distinct so that they can be called as an API. And Argonaut went a step further. So FHIR has over 99 or so resources. So all this.
And to be clear, these are well-defined RESTful APIs, resources, yes, defined by the consortium, by the team.
It's defined by the team, and they cover 80% of the use cases. So these 16, as you're seeing here, is patient, encounter, observation. All these are distinct data elements that can now be liquidated by APIs.
So there is a common understanding on how to define these 16 elements, these 16 APIs?
Bingo.
Okay. And what about the meaningful use, and what's the relevance of meaningful use here in the context of these data elements?
So in the CMS in October, they have announced that a patient should have access to their own data. And that's a very historic moment, because so far if you need a data from your provider, it's either fax machine or they cut you a USB drive, but having an API level access to your own data is what is truly going to transform healthcare.
So what you're saying is that the recent announcement, particularly, just to clarify, appears to be not only patients have to have access to their data, but that access has to be made available through API. That is the new news, right?
That is the huge transformation, okay, and the leap forward where the regulations are catching up with the consumer tech.
Okay.
And what will, now you'll ask the question, what will a consumer do with the API? It is to power the app of their choice to access their data.
So great. We now have some definitions of RESTful APIs called FHIR, and there is a compliance imperative to make it available through RESTful APIs using FHIR for these at least data elements, 16 data elements. So we are done, or is it still hard? What's the hard part?
Well, FHIR has definitely done an amazing job in identifying those standards and API, but even today, connecting Samantha's digital experience is hard, and you nailed it. Standards and implementation is a big gap. And today, and why they're hard, the complexity could be even imagining an experience, getting the ROI figured out, getting the team figured out. But the hardest part at the core is connectivity. How do you connect the data for Samantha from her pharmacy, from a provider, from a payer in a consistent way, and also that is able to scale? And that's where you have to think through the entire digital value chain.
What do you mean by that?
So let me cover that. As we talked about the digital experience, now look at Samantha. That's the consumer in the middle. At the heart of it is the experience. So in this case, yes, she wants that dashboard that we just saw. And at the back end is your system of records. These are your membership system, your EMR implementations, your labs, radiology, and what have you. So her data is scattered around multiple silos. And who will create these experiences? Developers. These are mobile app developers who are creating the new innovative apps. But they need an easy way to connect to these system of records, and that's where APIs come in. So yes, FHIR has addressed the common definition, ontology.
So haven't we had like APIs? We have data warehouses, ESBs, message-oriented middleware. We've had 10 years of integration in healthcare, and healthcare is a fairly mature industry in terms of all these integration technologies. So what you're saying, what is different about this time digital value chain that the current technologies are inadequate for?
Current technologies are very provider focused, meaning you are very busy exposing the interfaces. Where the shift in thinking with APIs is a consumption. How do you enable your innovation? How do you enable your internal or external developers in providing them an easy to use APIs that can scale?
I see.
These are not hardwiring your ESB or doing EDIs. It's flipping it more from the consumption standpoint, not an exposing standpoint, and that's the big pivot.
Fantastic. So today, if somebody wanted to realize the experience for Samantha using the connectivity of all these systems, how would they go about doing it in a traditional way?
So we talked about being hard. It's not just hard, it's amazingly time consuming. So as an example, today to create the dashboard that I just showed and to scale it to a reasonably good scale, it takes anywhere from 12 to 18 months.
Wow.
It's about thinking about the interfaces and thinking about your ESBs. The entire process is way too long. And that's where the gap is. That's why we're not seeing many FHIR-enabled experiences, because still the standard has done its job. How do you accelerate the implementation? How do you address the entire digital chain, which focuses on consumption, it focuses on scale, security, and so on and so forth?
Okay, so it sounds like we have a good start with FHIR APIs. We have good start with at least the minimum set of APIs that are required for compliance. But still, there's a lot of hard work to be done. So tell me now about what Apigee Health and the solution we have just launched does to address this problem.
So we talked about it's not just about a standard, it's not just about the API, it's about the digital value chain. So what I mean by that is Health APIx solution is thought through from the acceleration standpoint. It accelerates the value chain. And how? So in this case, you have innovative apps, be it remote monitoring, telehealth, wellness and prevention, and then you have system of records. Health APIx sits in the middle and matches the two speeds of your system of engagement and your system of record. We, again, from Apigee, we strongly believe that APIs are the connectors of the digital world, and we have seen that in many different sectors, be it retail, finance, telco. This is a solved problem there. How do you bring that to healthcare? And that's what Health APIx is aiming to really take it heads on.
Fantastic. So is this a fresh new product, or is it? Tell me about what is the X in Health APIx.
X is about acceleration, and it is not a new product. It is built on Edge, which is our flagship product. Edge is our API management. It does a lot of, again, consumption focus, does a lot of heavy lifting in providing security, providing the access management, token management, rate limiting, all the grunt work. That's what Edge does, which we have different use cases from telco finance. As I mentioned, we had amazing Black Friday.
That's right.
We supported companies
Yes.
like Nike and a few others in the hyper internet scale traffic. And now we are innovating on top of that. And Edge provides API services, which is all the grunt work that I just mentioned. It provides the developer services, creating a developer consumer focused, consumption focused, and analytics. Who has access to what? Now you need that transparency when you're opening your interfaces. How's that? Which APIs are getting called the most? Which are getting called the least? And now, with that as a solid core with industrial strength platform, we have added FHIR, the amazing work that FHIR has done in getting the meaningful use API. We have pre-built them on top of this platform. And not only that, any conversation in healthcare, as you know, Anurag, is a regulated industry. Without security is a non-starter. So it's a security-first approach. Security is not an afterthought. We are thinking OAuth to support the use cases like two-legged OAuth, three-legged OAuth, which do this business-to-consumer and business-to-business type of access and authentication management.
So what you're saying is that for API developer teams that are trying to use these FHIR APIs, we are offering out-of-the-box, built on Edge, which is our flagship product, which we are not going to go into detail today, but obviously there's a lot of material on our website and so forth to learn about. On top of that, we have built in advance all the FHIR-specific, FHIR-ready APIs, as well as all the trust and security framework that goes with it, as well as the protocols.
Bingo. And then we didn't stop there. We also created a healthcare-specific developer experience where they can connect the FHIR standard in a nice tailored portal. And I'll showcase in a bit.
Okay.
So now, as we talked about Samantha, we talked about her experience and about the 16. So the idea being Health APIx could be the accelerator for any needle-moving solution that our customers are planning.
So this speaks to the 16 set that we are launching with, and obviously these are absolutely mandated for the meaningful use compliance regulation. So that sounds good. So if anybody who's interested in meaningful use compliance, particularly the payers, they can obviously get started with this. Anything else? Are there other use cases, or is it primarily for meaningful use compliance? What's the value proposition or the scope of use cases that can be addressed today from Health APIx?
So we are starting with the meaningful use data set of 16 APIs, and they themselves have 80% coverage. So there's a lot of focus on when FHIR was designed on the implementation. So right off the start, the providers. However, healthcare, as you know, is a very fragmented industry. There's payers, there's providers. So I'll take an example. Medication adherence. So we talked about the chronic condition use case for Samantha with diabetes, but medication adherence is also a huge problem facing the industry. So if you have a pharma company or if you're retail like Walgreens, they all are building experiences on prescription refill. Now FHIR has a resource called medication. So now if you are a device company like Johnson & Johnson and you are doing remote blood pressure monitoring or diabetes monitoring, FHIR also has an applicability in the observation resource. So it has applicability across the spectrum. And now think of payers, the eligibility of benefits, the claims, consumer engagement, wellness and prevention. So even though the platform is one, it can power many use cases. So if our customers, if any of these directions, if they're thinking through and implementing any of these use cases, Health APIx would give them significant amount of acceleration and compress that time frame to go to market and to scale.
So you're telling me that it's not just about meaningful use compliance with providers. If you are a CIO of a healthcare payment company, insurance company, you would still have to worry about using FHIR, and they can benefit from that today. If you are a large pharma company or a med device company, you will still need it for patient engagement or patient use cases, whether it's clinical trials or overall patient engagement.
Yes.
And if you are a pharma retail company or any of the other partners like PBMs, etc., you would still require, you can still benefit from the current set of assets available through FHIR.
Right. It's about the crux of it is interoperability.
I see.
When they all talk the same language, then
see.
they don't have to build one-on-one interfaces. So from a payer, if I need, so I'm a payer, I need information from provider. Currently, it's very EDI way of getting the information. In some cases, it's even actually fax being sent back and forth. Now with the data being liquidated through FHIR APIs, this standard will power many, many use cases across the industry.
Understandable. So currently, if I understand correctly, there are about 99 or so full defined FHIR resources that cover the industry use cases, of which we have obviously launched 16. We have plans to cover those, the remaining 99 over time?
Yes, we have a rolling roadmap where we will be deploying these APIs with the cadence and with quarterly. One thing I would like to mention here is Graham Grieve, who is the original architect of FHIR, is also the technical advisor for this initiative. So we're taking his guidance on the level of maturity of those FHIR APIs, and very much part of our roadmap to have it completely FHIR driven and cover the 99 APIs.
Thanks for pointing that out, because we are, as a company, Apigee is fairly active in participating in the FHIR community, and both learning from it as well as contributing back based on our experience from other verticals. So that's good to know. So let's actually get down to what exactly does a customer get when they want to buy or use Health APIx. What are the solutions? What are the assets? Can you showcase some of that?
Yes. So enough talk. Let me show you now the solution. So I'll start with the developer experience. This is a tailor-made custom developer portal. As I mentioned, in the digital value chain, developers are very important. Now, this could be your internal developers and your external developers, and you may limit what kind of APIs do you want to give access to your internal developers. As an example, maybe more interfaces are available to internal and less are to your external, and maybe even limited set to partners. So you want that experience where different type of developer community can come and interact in a self-service fashion. And what they will find here is the APIs that they have access to. So in this case, what we have done, I'll assume a persona of a developer. I'm a super developer, so I have access to all the FHIR APIs. But you can limit it. And that's where security, authentication, token management, the goodness of Edge comes in. You can actually control it at the distinct or discrete API level.
Okay.
So all these are pre-built. We have taken the hard work, working with Graham in understanding these standards, deploying them as part of our platform, and deploy them, and you will get them by default.
So Aashima, what you're showing is actually a public-facing portal, right? healthapix.apigee.com, right?
Right.
And this is obviously a market sandbox.
Right.
So could you describe what the purpose of this market sandbox is, and what can somebody exploring FHIR APIs can do in this market sandbox?
Yes, absolutely. So as I mentioned, so there is a solution set where we have built these assets, but we also have created a reference implementation for folks to come try it out, gain more experience before committing yourselves to FHIR projects or interoperability projects. So what I mean by trying out, we saw the patient API, they can actually come register here. And in that case, this sandbox is connected to a demo database, which has the data for commonly used FHIR resources. So all 16 that we talked about, not only there are northbound APIs there, they're actually connected to the demo data in the backend. And now they can see different distinct, so I use the patient resource, you can search through it, you can get it, all the different operations are out of the box supported here. And we've gone one step further. Just like we build the Samantha's experience, if they have any good experience that they want to showcase, come to our site, register your experiences. that you are building to inspire and be inspired. Come to the site and sign up there.
This is very cool, and over time, I understand that we are hoping to add more API providers as well. Those folks who have systems of record, apps and so forth that have RESTful APIs exposed in FHIR standard, they can be made available through our portal as well.
Right. We have.
So is this available as white label? If a customer were to want this, not as a market reference, of course, but let's say healthcare system.apix.com, can they bring this in-house, what you just showed me?
Yes, so let me cover that. But let me first go back to the Samantha's Healthy, the experience. So the 3 key takeaways are here. One is that FHIR is finally here to help with the interoperability. Healthcare is becoming digital, and Apigee is investing heavily into bringing that standard and bringing those implementations to life. So how do you help the digital value chain? And this is, I'll cover what are the assets that we will get. So for example, we talked about lowering the barrier to innovation and interoperability. The developer portal that you just saw is for our on-premise customers. We are giving those assets at no charge. We are giving that for our on-cloud customers as well. The second challenge in realizing the Samantha's digital experience is around abstracting the system of records. And that's where those out-of-the-box APIs, which are pre-configured. The third is making the access secure and safe. So we have pre-integrated OAuth, as I talked about, which is the cornerstone for any digital health, right? APIs and OAuth, all that are inbuilt. And finally, enable quick MVP development. And that's where the reference implementation comes in. And how folks can get started is you can join the Apigee community through the portal. The URL is healthapix.apigee.com. Go and register yourself there. You can actually create your own health API accelerator as well. So to answer your question, they can take the same code and deploy it on their on-premise environment. Most healthcare customers may want that. And if you want the acceleration, we can provide that with the cloud as well. And then finally, we want more apps and experiences to be created and deployed so that when we talk about people like Samantha, we can create empowering experiences like we just saw.
Fantastic. This is very comprehensive. Thank you for sharing with us the whole scope of Health APIx, and more importantly, how to make life for Samanthas of this world better. Thanks, Aashima.
Thank you, Anurag. Pleasure to be here. And so let's see, we have any questions? What was the URL again? It's healthapix.apigee.com. So the second question from Nitin is, thanks for the tight webinar, very informative. Curious, how do these pre-packaged APIs interact with payer and provider systems? Great question, Nitin. So what the provider, so as an example, if you're talking to a provider system, they will get this accelerator pack in that it is taking away the many months that they will have to otherwise spend in understanding the standard and creating APIs, understanding the OAuth, putting those policies as part of the proxies. All that is pre-built. And also the portal that I just showed, they just have to swap the logo, and if they want more branding, of course, they are willing, they can build on top of that. But that's where the acceleration comes in, pre-built assets. The next question is from, when will support for the FHIR financial management resources APIs will be offered? At this point, it is part of our roadmap. We are actually working with 2 leading pairs in defining that and working with Graham. So I'm saying very soon.
And in fact, if you're interested in partnering with us on that, we are actually actively working with some pair community to define those. Yes, and the question is, are there any pairs who are using this? And the answer is yes. We have actually our first customer, McKesson, who is deploying this, and they are actively looking at using Health APIx for interoperability of some of the use cases they have.
And then we are working with some other industry-leading pairs as well in identifying their FHIR-specific use cases. So in some certain cases, it's around the consumer engagement, and in certain cases, it's around payer and provider communication. Those are the type of use cases that we are seeing coming from payers. So the other question is, does this mean all the involved parties like insurance companies, pharmacies need to use Apigee?
That's a very good question. Not really. What's really important is that the company that is exposing the data for interoperability, of course, it needs to use Health APIx built on edge to be able to do that. But like with any partner-led development efforts, the partner ecosystem can benefit by accessing these APIs as once defined through any methods that they have for consumption.
Great answer. The other question is, have any hospitals signed up? So
Short answer is we have several hospital systems that are using this. We are not at liberty to disclose them publicly right now, but the answer is yes.
Right, and then to add to that, with the meaningful use guideline that had just been released in October, so by 2018 they will have to provide an API level access to patient data. So what we will with the adoption will significantly increase to meet those timelines. For stage 3 incentives, so a lot more hospital systems we are anticipating and projecting to have them sign up with the solution. So the next question is, how does app developer know which insurance Samantha uses and which pharmacies he uses to create single view of the report? So this is where the experience building comes in, where you can give Samantha a choice to pick, is it Walgreens, it is CVS, and then the other switch side to that is Samantha using the solution will only be able to connect where these APIs exist. So all the API providers, so there's a consumption side and then there's a provider side. So we'll have to take, who are the pharmacy system who are providing those APIs, and that experience can connect to it. So what the beauty of FHIR is, it is interoperable, because if that experience was connecting to Walgreens as an example for medication, and if let's say CVS or Walmart today expose the same API, that experience will seamlessly connect. That's what it is about, the interoperability. Of course, you'll have to create the interfaces, but you hopefully are using the standard, and you only created once. Is there a catalog of participants? Yes, we'll be happy to share that with you as to who are the customers we are already talking to, having a relationship with, and many of them are starting their journey as we speak.
And as we make them public, they'll be made available on the portal, the reference implementation.
So other question is, have you established relationships with EMR vendors like Epic, and do you have proxies for their FHIR-based services? Who are they?
So let me answer that. We are working very closely with several companies that are API providers, and more importantly, we are working very closely with healthcare systems who obviously use Epic, Cerner, and many of these flagship systems. Our goal is to provide interoperability with any and all of these EMR systems. To that end, we have had experience in working with Epic systems and exposing them through FHIR-based services in many cases, and that expertise is being built out not just for Epic but for other key EMR systems as well.
Right. So currently, even Epic has a FHIR server. So as their open Epic implementation is gaining momentum, we'll be able to connect to their sandbox. But as Anurag said, at this point, when we do work with our customers, they have their own Epic implementation. That's where the connections have been, which is through the customer and through their existing Epic relationship.
Just to close off on that comment, it's important to realize that what Health APIx, our vision is of interoperability across different systems, not just a single system of EMR. That's often a solved problem. What we are really looking for is where you have interoperability challenges that span across a single healthcare system.
Right. We have time for one more question. It says, hey Aashima, Do you have a working demo example we can use to show our leaders? That is a dummy app with hashed patient data. Mike, thanks for the question. Yes, we have a number of apps. Some of them are listed on the app galleries. Some of them are being developed. So we want more use cases, but we definitely have, in some cases, dummy apps. In some cases, actually early prototypes that we have done based on FHIR, and we'll be happy to share that.
Reach out to us. We'll be happy to share with you some of the demo apps that we have to showcase the solution.
So let's take another question from Amol. Yes, as a pair, would love to explore collaboration with Apigee in FHIR financial management space. Cambia Health is active contributor, participant in the HL7 pair group. We would love that, Amol. And as I mentioned to you, we're already in discussion with 2 leading pairs. We would love to open up that discussion and have you actually work with us and take the leading role in defining those APIs.
Okay. So, final question. Many EMR vendors are using Smart on FHIR. What is your position on that? It's pretty straightforward. We absolutely advocate and support the Smart on FHIR initiative. In fact, we work very closely with Josh Mendel and all the approach they have. We believe that our Health APIx approach is complementary to the Smart on FHIR, largely because we are offering a different approach to interoperability, where you can bring any category of apps, not just smart apps, and while working also with the smart apps.
Right. So another thing, a great point there. So Smart on FHIR is more, where it is R&D, discovery. What we are bringing to the table, where Smart is the interoperability, we bring our rigor of API management. So we are an industrial strength platform for your initiatives. Smart never claims to be that.
Yeah.
When we talk to Josh, they want to create a reference implementation to get you acceleration and get started. What Apigee Health APIx is, when you want to scale to internet scale, when you want the industrial strength platform, that's where it becomes complementary. So they are complementary in that case.
Exactly, and particularly when you care about things like OAuth protocols, have there been and the security frameworks around your APIs, role-based access control, and many such capabilities, which get to production level scalability issues. Okay. We are out of time. We want to be respectful of everybody's time here. So once again, thank you for listening in. Thank you for your questions. Very provocative. If you have any questions for us, please do reach out to us directly. And thank you, Aashima, for a great session.
Thank you. Excited to be here, and thanks for listening.